Evidence-based practice refers to a decision-making process that integrates the best available research evidence, professional expertise, and the values and preferences of the individuals or groups affected. This approach is commonly used in fields like healthcare, education, and social work to ensure that decisions are based on sound evidence and are effective in achieving desired outcomes. It emphasizes the use of high-quality data and information rather than relying on assumptions or outdated practices. Evidence-based practice works by combining three key elements: research evidence, practitioner expertise, and the needs of the individual or community. Research evidence comes from scientific studies and experiments that are reviewed and evaluated for quality and relevance. Practitioner expertise refers to the skills and knowledge professionals gain through experience. Lastly, the needs and preferences of those impacted ensure that decisions are practical and respectful of cultural, personal, or situational factors. By balancing these elements, evidence-based practice helps achieve more reliable and effective results. Now let's look at some examples. In healthcare, evidence-based practice might involve a doctor using the latest research to choose a treatment plan that has been proven effective while also considering a patient's specific health goals. In education, a teacher might adopt a reading program shown through studies to improve literacy rates, tailoring it to fit the unique needs of their classroom. In social work, a caseworker might use research on community programs to decide which services would most benefit a family in need. Each of these examples shows how evidence-based practice combines research, expertise, and individual circumstances to guide decisions. Now let's look at some strengths of evidence-based practice. One major benefit is its ability to improve outcomes. By relying on proven methods, practitioners can reduce the chances of errors and increase the likelihood of success. Another benefit is that it encourages accountability. When decisions are supported by solid evidence, it's easier to explain and justify actions to stakeholders, whether they are patients, clients, or supervisors. Additionally, evidence-based practice promotes continuous improvement. Since it relies on the latest research, it encourages professionals to stay informed and adapt to new findings over time. However, evidence-based practice is not without its challenges. One challenge is the availability of high-quality research. In some fields, there may be limited studies on certain topics, making it harder to find reliable evidence. Another challenge is the time and resources required. Gathering and analysing evidence, as well as applying it appropriately, can be time-consuming and may require training or tools that are not always accessible. Lastly, balancing evidence with individual needs can be difficult. Even the best research may not apply perfectly to every situation, and professionals must find ways to adapt evidence-based approaches to fit specific circumstances. These challenges highlight the need for flexibility and creativity when implementing evidence-based practices.